A patient can download the app on their mobile device, either laptop, iPhone, or tablet, and if they want to see a doctor, they just press a button and they will connect to a doctor that's licensed in their state and can see them over video.
Rihal works for Doctor on Demand.
How are you, Nassim?
One of a handful of companies connecting patients with physicians almost instantaneously.
Hi there, I'm Dr. Rihal with Doctor on Demand. Welcome.
On the day we visited, Rihal took a call from Carmen Crandall and her 11-year-old daughter, Alexandra McCamick, from Naples, Florida.
If you feel here, do you feel any lumps or bumps?
Feels a little swollen in here, just a little bit.
And now I want you to bring the camera real close to your mouth and say, ah.
Can you see?
Yep, I got a good look there. It looks red, but I don't see any white patches. You can point the camera in the back of your throat and get a really good look at tonsils. It surpassed my expectations, the technology piece of it. And I think the future holds even more with all the wearable devices and all the information we're going to be able to transmit soon.
By the end of a 13-minute exam, which cost $40, Alexandra was diagnosed with viral sinusitis, and her prescriptions were sent to a nearby pharmacy electronically.
Why did you choose this service? Why not just go to a doctor that's in Naples?
You can't get an appointment. I mean, if your child is sick and you call and they say they can't see you until next week, it's pointless. Then you end up going to the emergency care clinic that costs $100 for your copay. So why not pay $40 and do it right then?
How's that going?
Beyond the convenience factor, Doctor on Demand's chief medical officer, Dr. Pat Basu, says the cost savings on a large scale add up.
In the United States, there's a total of about 1.3 billion total cases where people walk in to see a doctor. Of the type the Doctor on Demand is ideal for, you're talking about 300 to 400 million that we could treat.
You've got some residual cost.
At a rate of $40 per telemedicine visit versus an average of $1,000 for a trip to the emergency room, or about $300 for urgent care, Basu says the potential savings are enormous.
Right off the bat, that would save $25 billion to the U.S. healthcare system.
Such figures have caught the attention of insurance companies. In April, United Healthcare, the largest private insurer in the U.S., launched a partnership with 3 telemedicine companies, Now Clinic, American Well, and Doctor on Demand, to cover video-based physician visits just as it covers in-person visits.
Just review your medicine.
Health industry observers say it's the strongest sign yet that telemedicine is entering the mainstream.
Now we have over 20 million patients who have access to Doctor on Demand through insurance. On the government side, Medicaid and Medicare, that progression has still not fully occurred, but we are in conversations with state Medicaid agencies and national Medicare to cover this.
I'm going to tap on the tendon.
Dr. Abraham Verghese, vice chair of Stanford School of Medicine, applauds the efficiencies and cost-saving telemedicine will bring. But he's concerned about preserving the doctor-patient relationship.
A very important, I would say, ministerial function of being a physician is to be attentive, is to be present, is to listen to that story, is to locate the symptoms on the person of that patient, not on some screen, not on some lab result, but on them.
Do you ever feel like that you're missing something by not being able to touch the patient?
No. If I was taking care of heart failure and diabetes and things like that, I think I would feel really uncomfortable doing that over video. But the more common things that I'm taking care of, I feel good about what I'm doing, and I feel like I actually connect with the patients really well.